So now I'm going to introduce Dr. Cindy Lefton. We're really excited to have Dr. Lefton with us. She's well known for her contributions in helping hospitals across the country positively impact their communication and collaboration and use meaningful recognition to engage staff. She's a national speaker, author, and researcher and nurse on the topic, and we just think she's the perfect fit for where we are right now in our journey in the National Collaborative. So I'm going to turn it over to Dr. Cindy Lefton. Take it away.
Hi, everybody. Good morning. My name is Cindy. Thank you, Mary, for that really nice introduction. Wendy is going to hold my hand and make sure that I do this correctly. So welcome to my kitchen. And I'm going to hit share, and we're going to see if we go from a box to a presentation. Hang in there. I can intubate, but sometimes the Zoom is a little problematic. Can you guys see everything? Okay, great.
Yeah.
Well, again, good morning. Thank you so much for inviting me to be a part of this collaborative. I'm just thrilled to learn about the work that you're doing, and to be a part of it is just incredible. Again, I'm a nurse. I work in the emergency department at Barnes-Jewish Hospital in St. Louis, Missouri. We're a big academic medical center. I'm also an infusion nurse. I give chemotherapy to women with gynecological cancers at our hospital. I am an organizational psychologist for a company called Psychological Associates. No couches. We do team building, leadership development, and that kind of stuff. And I'm also the pro bono researcher for the Daisy Foundation that Mary mentioned. So the only thing that I have to disclose is that I love pizza. And in St. Louis, we're thin crust folks, but pizza is great, but it's not meaningful recognition. So if meaningful recognition is not pizza, what is it, and why is it consistently ranked as one of the lower items on the healthy work environment surveys? Well, meaningful recognition is a form of feedback. It's positive feedback. And feedback comes from interactions that occur between people. And so there's a behavioral component to it as well. So according to the American Association of Critical Care Nurses, meaningful recognition has these three components. It's acknowledging how what somebody did made a difference to you. So it's the impact of another person's behavior on you, how what they did mattered to you. It has to be relevant to the person that's receiving the feedback. And that can be kind of the tricky part. And we're going to talk about that in a minute. So again, relevant to the receiver, and it has to be equal to the contribution. So it can't be like, smarmy, like, oh, thank you for something that maybe wasn't such a big deal. But then it can't be like a thumb or a high five for this, incredible thing that just happened. So why is meaningful recognition so tricky? Well, I think based on the research that we've done over the years, it's because you can't define meaningful recognition, but you can describe it. And what do I mean by that? Well, you can't define it because what's meaningful to you may not be meaningful to me or to one of your peers. So there's this individual component to it. So again, you can't define it, but you can describe it. You can't put it in a template or a checklist either, because it's connected to individual differences. And again, I think that that's what makes it a little tricky. So what do we know about meaningful recognition, and why is it so incredibly important? Well, for years, the field of organizational and industrial psychology has been doing research on the impact of positive feedback. And we know there's tons of research out there, it lives in the psychology world, that shows us that when people get positive feedback about things that they're doing and how they're making a difference, it elevates our self-esteem and we feel good. When we get that feedback about our contributions at work from our organizations, we call that perceived organizational support. When you get that feedback about your job, that your work matters, you feel good about your work. And then you feel connected to your organization. So we call that organizational commitment. So when your self-esteem is elevated, you're committed to your organization, and you perceive that they value you, guess what happens? You stay. So meaningful recognition impacts retention. We also know that meaningful recognition is connected to work group cohesion. So how connected you feel to the people that you work with. And that's also connected to retention as well. I mean, think about it. Many of you stay where you are because you love the people that you work with and you feel very connected to your team. Literature has also shown us that meaningful recognition impacts job satisfaction, because if you feel supported and you like what you do and you feel valued, then you're going to stay and you're satisfied at your job. And guess what? If you're satisfied with your job, it increases the likelihood that you're going to have patient satisfaction as well. I challenge any of you to show me an organization or a unit or a floor or whatever that has great patient satisfaction scores consistently and doesn't have good employee satisfaction. The two go together. And then bottom line is that meaningful recognition impacts a healthy work environment. So building off of this research, for the past decade and some change, we've been doing a lot of work exploring what I call the 360-degree perspective of meaningful recognition. So we were looking at how does meaningful recognition impact the receiver? What's it like to get that kind of feedback? And we've published all this stuff, and so it's out there, but we know that when you get that type of recognition, it really makes a difference. And then we also wanted to understand, well, how does this recognition, how do leaders use all this positive feedback that's occurring in their organizations to shape and drive a culture that values people? And then we're doing some work right now. We did a very small study because we're really intrigued by these patients. They're sick, some of them die, and their families, write these incredible Daisy nominations or letters to the hospital, and we're thinking, like, you're really sick, or like you lost somebody, but you want to tell us about how incredible we were. Why? And so we've done some interesting work on that. We had one study that was published, and we're getting ready to launch a bigger one, but it's about the connection from the patient or the family perspective. That's a really unique dynamic to meaningful recognition as well. But there's one study that we did that I wanted to share with you in particular, because we did this, myself and a really brilliant researcher by the name of Dr. Leslie Kelly out in Arizona. And we had 24 hospitals, and it was like 1,100 nurses. It was 2016, so before the pandemic. We looked at the impact of meaningful recognition on compassion fatigue, compassion satisfaction, and burnout. And we found some really neat relationships, no surprises, but we found that meaningful recognition was a significant predictor of compassion satisfaction and decreased burnout, and highly satisfied nurses that had received recognition predicted compassion satisfaction. We also interviewed 96 nurses to understand what on the job restored their emotional energy, because we felt like there was a connection between meaningful recognition and emotional energy, which is really a component of burnout. Yes, I did say 96 nurses. Isn't that a lot for a qualitative study? It's a ridiculous amount of people. Yes. And when did we reach saturation? Probably at about 10 or 15. But because meaningful recognition was such a challenge for everybody, and the richness of the feedback that we were getting from the nurses about how they restored their emotional energy on the job, we wanted to really capture what they were saying so that we could provide that feedback. So we interviewed everybody that wanted to be a part of that. And again, we focused on how they restored their emotional energy at work, because you can't, ride a horse to work. Maybe if you live in Montana, you can, but where I live in St. Louis, Missouri, if you rode a horse to work, it would probably get stolen. We have a little bit of a crime problem here. But, my point is, you can't do a hot air balloon in the middle of the day. So what are people doing at work that restores their emotional energy? And these 4 themes emerge. The first one, the times you get thanked that stand out in your mind, is really, it's about appreciation on steroids. And what the nurses described to us was when these behaviors occur with the patients and the families, to them, that's a cue that their relationship with the patient is built on trust, and that's a form of recognition. So when a patient or family member says to a nurse, I'm going to leave this room and go get a cup of coffee. Can I bring you one? Or they remember the nurse's name, or the family says, I'm going to go home and I'm going to take a shower. Those are all behaviors that, again, are cues to a nurse that the family or the patient trusts them and recognizes their contributions. The second theme, seeing people get better right before my eyes, certainly has a clinical component to it. Or as one nurse said, getting the numbers right where I want them. Remember, these were mostly ICU nurses. But also there's a psychosocial behavioral component in there as well. As the nurses described to us, it's when all of a sudden you see that patient be able to calm and get settled, that they stop banging the side rails with their hands, that that deer in the headlight look disappears, that they just start to get calm and they settle. And so when that happens, the nurse perceives that as the patient trusts them and feels comfortable in their care. And that's a form of meaningful recognition. Knowing that people that I work with have my back, that's true collaboration. And that's about whatever rolls, crawls, or walks through that door. You know, you got people beside you, behind you, and if needed, in front of you to come together as a team to take care of that patient. And again, that's a form, that collaboration is a form of meaningful recognition. The fourth theme is about self-awareness. And often this happens in private. So it's the nurse at 3 o'clock in the morning talking to the patient, and the patient conveys their heartfelt thanks to the nurse. And the nurse increases their self-awareness of the impact of their actions. But again, that's the kind of stuff that happens in private. And since we nurses often say, well, we're just doing our job, we may just be doing our job, but according to over 1 million people that have filled out DAISY nomination forms and all the patient satisfaction comments and all the other forms that you get at your hospitals recognizing your work, our job, you all are pretty extraordinary. So based on all of this research, we have come to the conclusion that meaningful recognition drives the elements of a healthy work environment. Now, I am not saying that meaningful recognition is more important, because it's not. They're all equally important, and you all know that according to AACN, you have to have all 6, not 4, not 5, but all 6 have to be in place to have a healthy work environment. What do I mean that meaningful recognition drives the other elements? Meaningful recognition is a form of feedback that describes what these elements look like. So when a patient says to you, you took such great care of me, you made me feel like I was the only patient that you had, and I know you're busy. That patient is describing their perspective of what appropriate staffing feels like to them. At that moment, that patient is telling you that you have matched your skill mix with their needs, and that's what appropriate staffing looks like. When the attending physician pulls you aside and says, I really value your contributions at rounds. Thank you very much for pointing those things out. It really helps us do a great job. That's pretty authentic leadership. Or when the person from your dietary service comes out to you and says, I'm really concerned about this person. I've been bringing their trays for the past couple of days and they're not looking so good right now. Well, that's pretty good, true collaboration. So again, these forms of feedback, verbal and written, describe what these elements of a healthy work environment look like. And it isn't equal to pizza, although pizza is very good. Okay, so the main takeaway from this is that all of these things are occurring in your environments 24/7. Right now, while you're on this Zoom call, There is authentic leadership, effective decision-making, true collaboration, skilled communication, appropriate standard. All of these elements are occurring. They happen in your organizations 24/7. The idea is that you don't need to create them. They're already happening. I mean, you need to work in them, but they're there. They're existing. You need to put a mechanism in place so that you can capture, so that you can recognize them, and then feed that back into your culture. How do you do that? Well, first you have to go out and observe. And so this is a picture of one of our crazy ideas at Barnes Jewish Hospital. During the pandemic, I got pulled to the COVID swab team, and it's kind of crazy to take a nurse organizational psychologist and say, we're going to swab patients all over the hospital. So we're going to send this organizational psychologist all over the hospital, which was really pretty incredible. I learned a lot, and I got to go to every single unit in our hospital. We're big. We're like 1,100 beds. And what I discovered was what all of you felt just like me. Our souls were lost. Many of the leaders were sent home for safety purposes, and you would go up onto these units, and we were scared, and we were trying to take care of people the best we could, but we were lost. And so through our observations, we recognized that we needed to do something. We weren't sure what, but we knew we needed to do something. We knew people were not feeling recognized, that their souls were crushed by the magnitude of this pandemic. So we created this very crazy concept called the You Matter cart, and we filled it with stuff, junk, pens, pencils, gum, chapstick, candy. And we just started going all over the hospital. We were a pop-up, and we would just show up, and our whole goal was to thank people, to recognize them, and remind them that they mattered. So through these observations, it also gave us the opportunity to listen. The picture on your left is us at the trauma floor at about 11 o'clock at night with the singing bowls. I mean, you can look at them and you can see, how engaged they are. Again, to thank them and remind them that they mattered. The picture on your right, we wandered up to the lab, and prior to COVID, our lab had 9 people in the infectious disease lab department, or whatever it was called, some component of microbiology. And they weren't even 24/7. Well, when the pandemic blew up, all of a sudden they had 9 people. When we're the big place in a 17 system hospital, so they got hammered really bad. Because we heard that, because we listened, not only were we able to go back and recognize them, and we brought air plants, so reminding them to breathe, but we were also able to take their story, tell the marketing department about it, and they wrote it up and put it in the newsletter, and it gave them some meaningful recognition for the incredible job that they did. And then the other piece is you've got to go to the people. You can't manage or create a healthy work environment if you're sitting behind a desk all day. And I don't mean that in disrespect, because I know that many of you that are in leadership roles are like meeting to death. But you have to get out there to go to people so that you can observe all these incredible things going on, so that you can listen to what people need, so that you can tie that feedback to their needs. And you can do this through huddles, and you can do this through leader rounding, or just your rounds, because if you see and hear, you'll find out a lot. And the picture on the right is us at radiation oncology. Whoever goes down there, if you can even find it, it really meant a lot to them that we took the time to go out and to see them. So 4 years later, we've had over 15,000 interactions with employees, and it's been a really amazing, crazy experience. Leverage the talent that you have in your organization. On the left is my nurse manager in Fusion. She mentioned one day that she played the harp. So we spent $60 and we got her a harp, and then we parked her in front of the elevator, and we got all the night shift when they were coming down, and we gave them breakfast bars that cost like 6 cents. And we thanked them for the night work that they did and all the lives that they touched. And it really made a difference. And then we did the same thing catching the day shift before they went to work. And it really put them in a great frame of mind. Again, it's just recognizing people that they're for what they're doing and that they're making a difference. And then we've got Erin with the coffee cart. She just did that on her own and went around and gave people coffee. This is from my landscape company. Walked in there one day, and these are all Google reviews. You have them about your hospitals. You've got patient satisfaction data. You've got letters. You've got Daisy Awards. Take all that stuff and plaster your hallway with it, because that is telling people how you roll, and it's recognizing all of the amazing things that you're doing. And it sets the stage for a culture, and it tells people what the elements of the healthy work environment look like in your environment. And it's all there. Again, you just have to grab onto it and then leverage it. And then be crazy. Psych got blown up during COVID because they're all of a sudden now taking care of all these people that have behavioral health challenges, who now also have all these complex medical issues exacerbated by COVID. We found out about that. We took a bunch of ice cream sandwiches from a place in St. Louis, because all these people want to donate food. They're there. They want to help you. You just have to go to them and say, hey, can you do this? So we took these ice cream sandwiches up to our behavioral health floor, and just for them to feel that somebody had heard them and that somebody knew what was going on meant a lot to them. So I talked about, stuff and ice cream sandwiches and pizza and all of these things, but honestly, it's not the stuff, it's the symbolism behind the stuff. It's utilizing the thing to recognize somebody, to remind them that they matter, to thank them for the work that they're doing, to let them know that they're being seen and they're being heard, and they are making a difference, and they are making an impact. It is there. I promise you, you don't have to create it, but you do have to capture all the extraordinary things that are going on in your facilities and then feed it back. Thank you very much. Can I take any questions, or I don't want to infringe on your time though?
We ordinarily don't take questions.
Okay.
People can put something in the chat that we don't address during the meeting.
Okay.
And then we can send those to you, and certainly you could provide answers, and we'll get them back to the whole group.
Okay. Well, thank you all. Thank you for letting me be a part of your day. I really appreciate it. And to all of you in the South, I know you're going to take care of people, but also please take care of you and your families too.